This video is a must-watch for anyone who has developed wrinkles, sagging facial contours, jowls, drooping cheeks or eyelids, or whose face overall looks tired. Most importantly, you want to change that. Today, friends, we're going to talk about ptosis and the deformational type of aging. I'm going to tell you about some non-obvious things that cause the face to sag and look tired. I'll also show you exercises that can help eliminate this problem. So make sure to watch until the end. Before we begin, please subscribe to my channel and give this video a like, because it helps my videos get promoted on YouTube so that as many people as possible can see them. Friends, ptosis is a process in which the tissues lose their elasticity and the face gradually sags downward. And this is not only related to age, aging, the environment, or gravity, because gravity affects everyone equally. At 50 or 60 years old, two people can look completely different. The first cause of ptosis is excess weight. That is, when the fat tissue in the face increases, it stretches the skin under the influence of gravity. And be careful, if you decide to lose weight quickly, it can make the situation worse because the skin and connective tissue don't have time to adapt to the rapid weight loss. And these deformations will remain. Yes, you'll have less subcutaneous fat, but the sagging skin will stay. That's why, if you're going to lose weight, it needs to be a slow process. If you look at people from a young age to old age, what can you observe? You can see that with age, the spine starts to shorten, literally to shrink. Imagine a spring that is being compressed, and the more it compresses, the more tension builds up in the body, and the shorter the neck becomes. What I've noticed is that everyone with a short neck has a sagging facial contour. Just observe it. Pay attention to your posture. If your neck shortens significantly, you'll start to see sagging. Friends, I'm curious. Do you actually believe that at 50 or 60 years old, it's possible to completely eliminate a sagging facial contour or not? Please write your thoughts in the comments. The next unexpected cause of ptosis is tension in the skull. You usually hear about muscle tension, but few people mention that tension and tightness can also occur in ligaments, blood vessels, organs, and even the bones of the skull. As we age, nerve conductivity decreases, and nerve conductivity is responsible for metabolism and tissue nourishment. If there is compression, it further reduces nerve conductivity, which leads to fluid retention in the face. The face will become more swollen, and the skin will appear looser. And the next unexpected cause, which I think will surprise many, is the tension transmitted through ligaments and muscles into the fascial system from the internal organs. In other words, all these organs are interconnected. If there is tension in the intestines, it can be transmitted from the intestines to the liver, the stomach, the heart, the thyroid gland, the organs of the neck, and further to the face. That's why the tensions coming from the internal organs play a key role in the development of facial deformation. Moreover, I'll show you a simple example. Look, let's say there's a blockage somewhere in the intestines, in the abdomen. You touch the abdomen, it's bloated, tense, there's some tenderness, right? This knot of tension, this blockage, leads to tissue pulling, and the body literally starts twisting in this direction. You see, the shoulders start to curl in, the chest begins to collapse, the belly may, on the contrary, stick out, the neck starts to shorten, and this leads to the appearance of a double chin. But in reality, the cause is over there. By the age of 50 or 60, when a person has issues with the gallbladder, problems with the intestines, and so on and so forth, all of this leads to severe tension in our body, which deforms the face. And can you imagine, no one talks about this and no one thinks about the fact that at 50 or 60 years old, the face looks aged not just by chance, but because it's a specific biomechanics of aging that occurs at the level of the face and the entire body. And the next important cause of facial deformation and the appearance of jowls is swelling. Everyone who suffers from swelling experiences the deformation process accelerating, I think, even 10 times faster. Why does this happen? Because when fluid accumulates in the subcutaneous fat tissue, it increases the volume of the tissues. And since the skin is thin, it simply starts to stretch. For example, even if you've done lymphatic drainage or restored your body's water balance, the skin still remains stretched and deformed. It's very important to make sure there is no swelling on the face. Do lymphatic drainage exercises and lymphatic drainage gymnastics daily. It's possible that exercises alone won't completely solve the problem, but in most cases I've observed it's even possible to fully restore the facial contour. And as I promised, I'll now show you an exercise that will help release these tensions and lift the facial outline. Take hold of the corners of your mouth with your hands. Many muscles attach in these areas, which are connected to the neck and even the chest. you grasp the corners of your mouth and then begin to alternately pull them upward. At the same time, you can even slightly tilt your head. And I'd like you to close your eyes. You may notice that on one side, the corner of the mouth lifts easily, while on the other side, it's harder to raise. Why is that? It's directly related to tension. Try to feel where that tension is coming from. Most often, you'll notice that this tension comes from somewhere in the body. Place your hand on that area, say, for example, on your chest, and on the corner of your mouth, and stretch as much as possible. You can hold this stretched position for a while until the tissues begin to relax, or you can slowly make circular stretching movements. And we do this for about 2 minutes, just stretching and making circular movements while observing what's happening. Don't forget to breathe. Inhale, exhale. And after that, you can smile and see how the smile feels. You can then do a retest and observe how the tissues move on one side and on the other. And you'll feel that on the side where you did the stretching, the corner of the mouth lifts more easily. After that, do the same on the other side for 2 minutes as well. Grab the corner of the mouth, place your hand on the chest, on the sternum, create some tension, and make circular movements. At first, you might feel some tightness or a kind of heaviness appearing. If you keep your focus and your hands on that tightness, making those circular movements, you'll feel that the tension gradually relaxes, and eventually the tightness might even disappear completely. And after that, the corners of your mouth will start to lift. And along with them, all these surrounding structures will begin to relax and lift as well. Next, you can simply do one of the easy and effective exercises. This kind of nasal massage like this. Circular movements for the nasal massage. What does this technique do? When you move your mouth, the movement itself creates a massage effect. These muscles begin to relax. First and foremost, the muscles that relax are the ones responsible for facial ptosis and tension. And next, after that, I recommend regularly doing lymphatic drainage. Your movements should go from the chin toward the ears. I recommend doing this regularly. You can even do it like this. So, for example, if you're in front of a reflective surface like a mirror, you can carefully and gently use your hands to make smooth and even motions or movements in one direction and then slowly in the other. This is the bare minimum to help relax this area and eliminate stagnation. And remember, a sagging face and deformation are not a sentence, and it doesn't mean you need to run to a plastic surgeon right away. Subscribe to my channel. This was Dr. Alice with you. See you next time.